I am Dr. Chandrika, practicing as an obstetrician and gynecologist at Chirag Hospital, P Nagar Phase. And I am also a visiting consultant at Manipal Hospital, Jayanagar 9th Block, and also Apollo Cradle Hospital, Jayanagar 5th Block. I also do visit as a consultant in Motherhood Hospital of Banshankari 2nd stage. Coming to overdue pregnancy, when action should be taken. All of you, I am definite that you will all be going for a routine checkup when you are pregnant. That is, every month there is a checkup. So your doctor will take care of it and she'll be almost alert and she'll know that you are expected, you will have some particular date when you have to be delivered. Usually normal pregnancy will stay for 40 weeks. That is the routine duration of a normal pregnancy. Full term pregnancy, 40 weeks it has to stay. So till when you can wait. See, in olden days what I used to tell is when the pregnancy has to get overdue, it should cross that 40 days. And what we used to tell in olden days was once it gets overdue, your placenta is the one which is supplying the blood vessels for the baby. So that placenta will have the capacity to continue the pregnancy even 2 weeks beyond your expected date. That was what we were routinely following. But of late what we have seen is all these babies of late, suddenly they have problem, and if we try to overcross that 40 weeks, they suddenly have intrauterine death. So that is the reason nowadays we obstetrician don't allow the pregnancy to advance to a very long time after your due date. So we'll see so many other factors. We'll see the Doppler studies. How is the blood supply for the baby, blood supply for the brain of the baby. All those things we'll see and decide when the person has to deliver. So optimal time that the pregnant lady should deliver is at least she has to cross about 37-38 weeks of pregnancy. So depending on the findings that what we get in the scan, we decide whether that particular patient can go beyond her date or what action should be taken depending on the findings that we see when we do her pregnancy checkup. This is what I would like to say about overdue pregnancy. One more thing I would like to tell is overdue pregnancy. What happens for the pregnancy is that baby, it starts maturing more. When anything like any vegetable, any fruits, when it matures, no, like baby also starts becoming over mature. What happens when it gets over mature is it will start becoming more harder. And one more thing is the weight of the baby also will be increasing till it gets the blood supply from the mother and all that. So it will become oversized baby. So oversized baby is always a problem for delivery. So that is also one reason we should not allow the pregnancy to advance too much. That is one thing. And as the pregnancy advances, the fluid that is around the baby, what is called as amniotic fluid, that amniotic fluid also gradually it reduces. The volume of the amniotic fluid reduces. So that is also one reason we should not allow the pregnancy to advance too much after the date of the pregnancy is completed. So these are all the factors which give importance to over mature pregnancy, and it should not be going to over maturity.